Morning, Monday. Gonna be a great week. Going to be a great week. We are back. Healthcare, high ground, chiropractic awesomeness. COVID update 420. Shout out to my sister-in-law in Colorado. So, we've done enough graphs, we've done enough charts, things like that. We're going to do a couple more. I want to do a little more research articles today. What's going on? How's it being presented to us? I think you have an idea. Man, it's just becoming more and more evident as this goes on that this is just a giant steaming pile of BS. 80% of cases of COVID are mild. Statistics are wildly exaggerated. We covered last week how the numbers in New York jumped over 10,000 because they added 3,700 new COVID deaths that were actually never tested. It was in the New York Times. Research shows plasma from recovered patients helps sick patients. You know where that research came from? The 1918 flu pandemic. And they're realizing, oh, wait, the body still has an immune system and it still works. Recovered COVID patients, plasma is helping the sick. What does that tell us? That this whole lockdown thing is unnecessary. We need those who are low risk to become exposed. Why? Because it builds antibodies. We can take those, we can give those to the sick people, and then help them recover. Science. It's pretty simple when you want it to be. And again, too, this is a virus. What do viruses do? They mutate. They always do. So we've got over a decade's, 2 decades worth of flu shots that aren't even as good as a coin flip. And they're telling us that we need a vaccine for COVID. And they're going to develop it in under a year. I have faith in that. Anyway, again, about 80% of people get a very mild illness and they recover uneventfully. Where did this come from? An emergency room doc. Where? In New York City. One of the hardest hit places in the country. Hey, 80% of this doesn't even matter. It's come from WebMD here. Here's another one from WebMD. From what we know so far, the CDC reports that close to 80% appear to be mild to moderate cases. Then why all the hype? Why do we have to take what's happening in New York and spread it across the country? Before vaccines, doctors borrowed antibodies from recovered patients to save lives. Doctors first tried injecting patients with blood plasma in the early 1900s. It's been used against diphtheria, the 1918 flu pandemic, measles, and Ebola. You know why? Because whoever designed this thing, who built this thing, doesn't matter who you believe, God, Jesus, Buddha, Allah, just happenstance, coincidence, Mother Nature. Whoever made this thing, this skin-covered meat sack, didn't make it with a surplus of organs or a deficiency in chemicals. Whoever made this, designed this thing to live, to thrive, to survive, to beat this kind of stuff that's floating around. Provided you treat it right and you fuel it right. A large percentage of those who are succumbing to COVID, 97% in some estimates, have other comorbidities. Diabetes, obesity, lung diseases, pre-existing. Because they didn't treat this thing right. Okay? When enough of the community is immunized against a contagious disease, most other members are protected from infection because there's little opportunity for the disease to spread. This is from the National Institute of Health. This is herd immunity. How do we get most of the community immunized? Don't lock them up. You can't build herd immunity if you're staying in your own home. Here's another question. How come you don't hear a whole lot about whole families getting sick? The guy who developed chiropractic, he had one thought in his mind. How come 2 people can be sitting at the same bench at work? This was back in the early 1900s. Sitting at the same bench, working at the same place, doing the same thing. One person gets sick, one person doesn't. Why does that happen? That's what he wanted to investigate. That's what started him on discovering chiropractic. His name was D.D. Palmer. He wondered about herd immunity, basically. What causes one person and their skin-covered meat sack to get sick and ill and the other one not? But again, we can't develop herd immunity if we're sitting in our house all the time. Now, if you are in a sect of people who are at high consequence for this kind of thing, i.e. 55 plus, multiple comorbidities or mortalities, yeah, compromised immune system, you might want to stay indoors. If you don't fit into that category, why lock up? What do we got going on here? We estimate. Oh, this is the Stanford study. What does it show us? It shows us that COVID-19 is everywhere. Man, it's everywhere, and that's awesome. Why? Because it shows that more people are actually fighting it than dying from it. You know what's really cool about this whole thing? As the number of deaths, death isn't cool, but as the number of deaths stay relatively constant, while the number of infections increases, all that does is goes to prove over and over and over again that this isn't a big deal. Because the more people that have it, with the same number of people that still succumb to it, means this is less and less of an issue. It's not as dangerous as people think. We estimate about 100 deaths from the county. 100 deaths out of 48 to 81,000 infections corresponds to an infection fatality rate of 0.12 to 0.2%. This is from the Center of Vital Statistics. Wanted to show you just this thing right here. Those 55 plus. 91% of COVID deaths. The amount of people who died, 91 were over 55. 91% were over 55. This thing doesn't pertain to everybody. It is an absolute travesty that people are losing family members and losing friends. But it is truly a travesty, too, that this is being extrapolated across all other age groups and races and different sects in the country, S-E-C-T-S, in the country. This isn't something that pertains to everybody. But it's something that's going to affect everybody. Because the fallout from this will take far more lives than this whole thing ever did. We went over these last week. This is current as of this morning. These numbers are smaller than these numbers. What's that tell us? Again, not that big of a deal. But again, just so you know too, chances of exposure have a higher chance of going to the hospital for the flu or from properly prescribed medication from your medical doctor than you do because of COVID. Now, places are lifting restrictions, like Texas. Awesome. Does this upset you? Stay home then. Gotta get as many people under chiropractic care as can. Spreading truth. Not gonna find it anywhere else. Like I said, Governor Hot Wheels, open up the state. Love it. Germs don't make you sick. Research on chiropractic and immunity. This is a blessing. I love what's going on now. I absolutely do. Because people are taking control of their health, and it's so cool to see. It really is. It's just, it's fun to see people realizing that they have a say in what the rest of their life is going to look like. It's really cool. You guys have an awesome rest of your week. I'll be back with you Wednesday. Check in tomorrow on Tuesday for our weekly video on YouTube. Tip Tuesday. I don't know what I'm going to talk about yet. It'll come to me. Either way, have a great week. Have an awesome rest of your Monday. Kick ass. Take some names. Get outside. Go for a walk. Love you guys. See ya.